Welcome, everybody. My name is Michael Greenwald. I am the third vice chair for DeKalb Democrats, and I am so excited to help launch a new monthly webinar series tonight on behalf of DeKalb Democrats. The purpose of this educational series is to bring together experts on a variety of important issues to help local voters better understand them and understand how they affect us. Each month, we're going to do a deep dive into different topics, leveraging the experience and different perspectives of a variety of experts, and answer your questions to help you become a better informed voter. We have a number of events already coming up in the next month. On May 7th, our second webinar is going to be on learning about the Public Service Commission. On May 21st, our Special Events Committee is hosting a Public Service Commission candidate forum, and in June, with a date to be determined soon, we're going to have one on gun violence. What will it take to reduce gun violence in Georgia? But today, we are going to be talking about environmental health. Environmental health in Georgia, specifically, what are the risks to environmental health in Metro Atlanta and our state in 2025, and what needs to make a better future? By the end of this webinar, you should be able to highlight at least 3 specific threats to environmental health in Georgia this year, identify a few recent or pending pieces of legislation or events that will affect environmental health in Georgia in 2025, and hopefully cite at least one action that you could do to help with the current challenges we face. So we are excited to have 3 panelists, 2 of whom are right here on our Zoom session, and one is going to be on momentarily. I'm going to introduce first Dr. Preeti Jaggi. Dr. Jaggi is founder and chair of Georgia Clinicians for Climate Action. She completed her medical degree at Ohio State University, after which she trained in pediatric residency at Loyola, and then completed her pediatric infectious disease fellowship at Northwestern University. Dr. Jaggi is currently a professor of pediatrics at Emory University and medical director of the antimicrobial stewardship at Children's Healthcare of Atlanta. She has completed training with the Climate Reality Project and the Climate Health Organizing Fellows Program through the Center for Health Equity, Education, and Advocacy, Cambridge Health Alliance. Under her leadership, Georgia Clinicians for Climate Action is partnering with local community groups such as Mothers and Others for Clean Air to advance electric school buses for districts through a grant from Georgia Drawdown. She's been a powerful advocate at the Georgia Public Service Commission on the adverse effects of climate change on human health, and I am so thrilled that she was able to join us here tonight. Dr. Jaggi, welcome.
Thank you so much for having me.
Absolutely. And next, we have Freyasia Young. Freyasia goes by Free. Free is an environmental health and policy consultant for Brown and Associates and chair of the Environmental Justice Committee for the DeKalb chapter of the NAACP. As a dedicated advocate for community-led solutions and environmental policy, her focus is to bridge gaps between policy frameworks and local realities, ensuring that community perspectives are not only heard, but actively integrated into environmental policymaking. And finally, she's committed to the practice of public health, recognizing the inseparable link between environmental well-being and human health. Free, thank you so much for joining us tonight.
Thank you so much for having me.
And while he may not be on here yet, I'm going to go ahead and introduce our third panelist tonight, who will be joining us momentarily, and that is Daniel Blackman. Mr. Blackman is a nationally respected environmentalist and civil rights advocate. He was appointed as regional administrator for the U.S. EPA under the Biden-Harris administration. And there he led the largest EPA in the country, Region 4, overseeing 8 southeastern states and 6 federally recognized tribes. In this role, he managed billions of dollars in federal investments for water, energy, climate, infrastructure, and played a pivotal role in deploying emergency response strategies for hurricanes, industrial disasters, and environmental crises across the region. He's been a vocal advocate for environmental justice, clean energy investments, and beyond public service, he's a founder of Renaissance 94, a global consultancy dedicated to advancing climate resilience and equitable transitions. Through his leadership, he's helped nonprofits, corporations, and philanthropic institutions developing strategies rooted in sustainability, equity, and cultural impact. So I look forward to Mr. Blackman joining us momentarily as we get his communications set up. I want to explain briefly about the format for tonight, and then we're going to get to it. This is going to be a conversation. We're going to start it. I have lots and lots of questions, too many questions for just 60 to 90 minutes to ask, but I encourage the panelists to jump in, and I also welcome anyone's questions in the Q&A. We're going to get to them probably in about 45 minutes, depending on the conversation's going. So please think about those questions and we'll get to them. As a disclaimer, standard disclaimer, the statements expressed by the panelists are their own and do not necessarily reflect the views of their employers, DeKalb Democrats, the Democratic Party of Georgia, or the Democratic National Committee. And with that, I am going to start the conversation with Dr. Jaggi. So my first question to you, Dr. Jaggi, is if you could you just describe some of the current manifestations of disease that we think are associated with climate change, unsafe water, unsafe air?
Yes, so many things to talk about. So I want to just tell you a little bit about myself. I'm an infectious disease doctor. And, when we think about infections, we oftentimes think about like where the patient has been. Have they been exposed to a certain animal or a certain, a stream or something like that where they could have gotten an infection? And kind of really baked into my specialty is this concept of One Health. And One Health is the idea that the health of humans and animals and our ecosystems are all connected. And so this idea of One Health actually came up in the 1880s when they were really talking about zoonotic infections you get from an animal. But now we're really kind of saying, oh goodness, this is really, really, the ecosystems are so important. And so we know with climate change, we have more extreme weather of all kinds because warm air holds more moisture. So we know we have more hot days, which leads people to go to the emergency room for heat stroke and things like that. We know that's very, very bad for migrant workers who might be out very long periods of time outside. We also know that when we have extremely precipitous rainfall, which happens with climate change, we know that our waterways can get overwhelmed. And so you can get diarrheal illnesses. That's been well described. We also know that an animal actually that's very, very dangerous, which is the mosquito, breeds in water. And so there's been local transmission of malaria in Florida because of that standing water. So it's another example. So a lot of what I see as an infectious disease provider might be the indirect effects of climate change, where a vector such as a tick or a mosquito might have different areas that they go where we didn't used to see those. And then we know that there's hunger. And for children, I would say the other thing is climate anxiety. A lot of children and young people are experiencing climate anxiety. We know that there's been a couple of really big surveys of people 16 to 25 years old. And a significant number, about 75%, are worried to some degree about climate change. And they've actually done those same surveys in Georgia, in all 50 states, and about 25% of our young people are extremely worried about climate change. So I think that's another thing is they're worried about their future. So those are just a couple of the things. We know that there are other things as well because it disrupts your livelihoods and all those different ways that climate change can affect your security. So I think that's another really big thing. But those are some of the highlights.
Thank you. And that makes me wonder about the things that are specific to our immediate environment free. I wonder, what are your particular concerns about environmental impacts on health in the Atlanta area, close to home? What are you seeing?
So immediately I'm thinking the cumulative impact of air pollution for sure. There's a over concentration here as well as the encroachment of industry in residential communities. And I'm saying that as a resident of Stonecrest, we've had an ongoing battle with the city of Stonecrest, and a community group called Chase have an ongoing battle with Metro Green in terms of the concrete crushing inside of or close to a residential area. And so it's the cumulative impact of multiple sources of pollution, and how that affects our health in terms of our Black and brown communities already experiencing disparities in health outcomes. And then we have this overaccumulation of air pollution kind of like overburdening of us or overburdening us even more. And so we're seeing higher rates of asthma, COPD, and things like that. And to just on the grassroots level, because a lot of my work is grassroots, there's a lack of awareness. And so that's also a threat too, right? Because we have this overburdening or this accumulation of air pollution, and then we have a community that'll be right there, sitting in the air pollution that's just unaware of how detrimental that is for their health. So we have that. We have the climate impacts that we're seeing, that are becoming more and more egregious, especially when we look at communities like Peoplestown in Atlanta that deals with flooding. And of course, we know that is a result of multiple things, but mainly the, I don't want to say the intrusion, but it's close to a highway, a major highway, I-20. And so that runoff, they get that runoff. We have multiple communities in the Atlanta area experiencing that. So the cumulative impact of pollution and definitely the flooding, the encroaching of industry and community, and then a lack of awareness on the ground is definitely a huge concern in the metro Atlanta area.
Wow. And of course, there is that not so little event that happened just 7 months ago at BioLab, once again, that I definitely want to get to before this hour is over. But Mr. Blackman just got to join us. Mr. Blackman, I got to introduce you already, but I wanted everyone to get to hear from you. And I wanted to start it off with a question just in general. We talked about your role in the EPA, and I wondered what are some of the important projects and accomplishments that you saw through the EPA during the last administration. Can you give us an idea about what was accomplished and also what's their status now? Are they being undone? Please.
Yeah, look, first and foremost, what I'm excited about is today, happy Earth Day, everybody. I joined 6 of the 10 former regional administrators in writing a letter directly to Administrator Zeldin in our dissatisfaction for the direction of EPA. I think it's very important for us to understand that we do not have to sit in a state of paralysis while this current administration is rolling back some of the biggest advancements in the history of our nation. The Inflation Reduction Act, the bipartisan infrastructure law, policies that helped to bring over $4.6 billion during my time at EPA to the region, including over $50 million for electric school buses. We had tens of millions of dollars for not only the Port of Savannah, but the Port of Brunswick. We were able to give $350 million of a WIFIA loan to help with DeKalb County's water infrastructure as DeKalb grows like many other counties. We were able to address issues that put preventative measures in place, such as tracking pollution with trucks that leave the Port of Savannah and go all over our state because of the infrastructure or the lack thereof throughout Georgia, preventative measures to address flooding and extreme weather events. So I'm very proud of the work we did. Freyasia mentioned, the work overall and just kind of like where we are. I think it's important for us to also know that communities like Southwest Atlanta, where Vine City and English Avenue are, we can't leave these conversations that are difficult at times out of the conversation. One of the hardest things that I remember doing while a regional administrator was fighting for the people of Jackson, Mississippi that have a lack of access to a strong, structured water infrastructure system. We were very proud to get over $600 million to the city of Jackson. We're proud to get water infrastructure to Lowndes County, Alabama. These are areas that we're proud of, but the reality is this current administration sees it very differently and has identified organizations and individuals that are focused on energy, infrastructure, environmental justice, and quite frankly, the rule of law as it relates to protecting human health and environment in a very different direction. And I'll tell you what, the last thing I think that's critical for what I wanted to say is that we are not going to allow 20 and 30 years of environmental progress to be wiped away in 3 months. We are not going to do it. I believe the people on this call will fight for that. We'll stand up for it, and we'll make a commitment over time to make sure that we protect our most vulnerable communities.
So, follow up to that, many of us are acutely aware of the cuts and the layoffs at the CDC and other parts of the government, but I'm not as familiar with how it might have affected the EPA. Has DOGE turned its attention to the EPA?
Oh, hands down. I mean, when I was regional administrator, we created the first ever Division for Civil Rights and External Civil Rights and Environmental Justice. We combined working with the Department of Justice and the EPA, the agency's first ever standalone space to address environmental justice issues throughout our country. That's how we were able to move so much resources into frontline communities and overwhelmingly impacted communities. Look, when the California wildfires were devastating Altadena, California, and in several parts of Los Angeles and Hollywood and other areas, one of the areas that DOJ unfortunately cut that had a tremendous impact on our communities was having moved individuals responsible for disaster response and recovery that were supposed to leave Region 4, where I led, that tested water, that tested infrastructure to actually prevent them because they were quote unquote DEI hires. You had 15 qualified individuals to test air and water quality that because of the Trump administration were removed because they were under the purview of environmental justice and diversity, equity, and inclusion. And this is a problem, right? It's a problem because DOJ has not only cut, but they have made it a fundamental challenge. And I can guarantee one thing, the EPA will suffer over the next decade. It will suffer. And the reason why is because we were already going through the federal government, what's considered a silver tsunami. We're losing many of our most talented individuals and career employees because they've been there for decades. The young people that we're hiring in STEM, the engineers, the chemists, the scientists, these individuals were 1-2 years into their position. Less than 7% of the EPA's entire agency of 16,000 is under 30 years old. So we are losing a generation of scientists, engineers, mathematicians, inspectors, chemists, and we have to change what is happening because they have already shifted the priorities from being able to recruit to cutting back and scaling back. So I think we're going to suffer from that.
And WABE just reported yesterday that the Geologic Survey's office in Norcross may be closed by DOJ. So this affects waste, drinking, and stormwater management. And I wonder if that's true, if that happens, then what? Do we have local resources to fill in the void? How do we respond to that?
We do not, because EPD, and look, we were great partners with EPD. The way the federal government works is there's something called interagency collaboration. So you take BioLab, for example, there are Georgia Emergency Management, EPA, EPD, FEMA, Homeland Security. There's an apparatus in place where we're able to respond and address those issues. What you're seeing right now with this anti-climate, anti-environmental justice space is you're seeing a tremendous push where we're actually not prepared. I mean, we literally cut the IRS in the middle of tax season. We cut NOAA right before hurricane season. We're cutting the EPA at a time where Augusta, Kentucky, areas around our country, Asheville, North Carolina, are still not recovered from the flooding and the lack of infrastructure. So I think when you look at areas like that, my fear is our labs. EPA has a lot of labs around the country, including Cincinnati. Athens, Georgia is our biggest lab for testing water. As a matter of fact, when East Palestine train derailment happened, it was the folks in Athens, Georgia, our team that we deployed to East Palestine, Ohio, to make sure the water was tested, and we were able to give reports to the White House as well as to former Administrator Michael Regan. So when I see things like this happening, the Norcross office and these areas are areas that we actually set up command, correspondence, and impact, and I'm very concerned about their closures.
Wow. Well, you mentioned BioLab, so I guess we should just go ahead and jump into that because that is recent and so pertinent to our community. Georgia Public Broadcasting recently launched a podcast series on this, and I've been learning so much that I didn't appreciate when it happened, and it wasn't the first time that it happened. But it was just 7 months ago that there was this huge fire at the BioLab factory in Conyers after Hurricane Helene. This wasn't the first time, but apparently 12 million pounds of chlorine products were contaminated by water, causing this explosion. 17,000 people were ordered to evacuate. 90,000 people were ordered to shelter in place. 1,000 people from the area sought medical evaluation for symptoms that could be associated with the chlorine exposure. We know that there are a number of different health risks to chlorine exposure, and these products include cyanic acid and cyanamide. The EPA turned over air monitoring of the area to BioLab after a few weeks following the explosion. Is this a standard procedure? And if so, do you think that this procedure should be changed? I think you're on mute.
As much as I would like to celebrate the accomplishments of the Biden-Harris administration, there are gaps that exist throughout federal government. Let me just be very clear. I mean, I'm very proud to have worked both during the Obama administration as well as the Biden administration. And the federal government and the structures are tremendously disconnected, and there are gaps. I think the EPA's response, quite frankly, after my departure was a little subpar, because the way we operate in the past, obviously our public affairs division would coordinate with headquarters would coordinate with the region, and then we would basically deploy a division, for example, our air division, water division, so on and so forth. The problem that we've had is that the EPD during BioLab took the lead, and within a 3-week period, the director of what we consider central command from EPD was changed out 3 times in 3 weeks. Right? That's not normal. It's not normal to change individuals out that are responsible for the connectivity, the correspondence, the responsiveness, and the messaging. For example, if you live in DeKalb, you heard on certain days where they said it's safe to go back to school, but you can't go to work. Or you can go to work, but you got to be back in at a certain time, or you have to go out at this time. There was so many communications that came from GEMA, from Homeland Security. No one knew what was the accurate information that was coming. Yet and still, we partnered with Georgia Tech, and we got air quality data from Georgia Tech that EPA wasn't reporting. And EPA's reason was that they were not reporting information based on EPD being the lead organization. And that is an excuse. The Chemical Safety Board came in, I believe, in October, and it still took an exorbitant amount of time for us to be able to understand the severity and the impact, notwithstanding that BioLab, not once, not twice, but 3 times, almost 4 times, had been in severe violation, and we saw these impacts. So I think the answer to your question is more so not centered around EPA, but the functionality of it. We saw it with BioLab, we saw it with Sterigenics, we've seen it with companies, with Hercules. There are communities and infrastructures around the state that have lacked, quite frankly, not just the leadership, but the capacity. And what we're currently seeing with this administration is going to severely decapitate the opportunity and the ability for them to respond, build efficiency, and also build logistics in with how we are testing our water and our air to protect our most vulnerable communities.
So help us understand, because it gets confusing for those of us who are not in the weeds in this world like you are, about the different organizations and who does what. The BioLab fire, the repeated fires, is terrible. I mean, it happened over and over again. It wasn't the first one. In fact, so much so that apparently first responders in DeKalb refer to BioLab as Fire Lab because it happens so often. In 2004, they had the first fire. In 2015, there were 6 Rockdale County firefighters that were injured. And then another fire in 2016 and 2020. Who's responsible for preventing these things? Is it the Chemical Safety Board, the EPA, DPH, OSHA? Where does the state legislature fit in all of this? Who's supposed to make sure this doesn't happen?
Well, I mean, look, that is a complicated question, because I told Free Asia this. I think the most valuable thing about me being appointed by President Biden was I got to see behind the curtain. So I kind of understand how these things happen. Look, to be fair to Governor Kemp and to the EPD, they, like other federal agencies, are understaffed. I mean, there is a severe lack of workforce development and pipeline to those positions that are in a position to be responsive. But to your question on BioLab and who's responsible, look, when you have these companies and corporations that are making tens of millions of dollars a day, and you give them a $800,000 fine, I mean, that's pennies. I mean, they're going to make that back in a couple of hours. What we need from let's start with our state government. We need bad actor legislation, point blank, period. The buck stops with the legislative body being more of the enforcer to create legislation. And this could be bipartisan legislation, because look, one day it's BioLab, the next day it's Juliet, Georgia, where coal ash. Look, the largest fine and lawsuit in the history of this country around coal ash was Duke Energy being fined in North Carolina. And the same thing is happening in Juliet, Georgia. So we need our state senators and our state representatives to understand that there are actually safeguards you can put in place. Once the state legislature does that, EPD can then functionally operate in a way that there are guidelines. One of the things that I was told by a Republican state director of a state agency was, he said, Daniel, I want to work with you. But he said, one of our biggest challenges is when administrations change, priorities change. So while we want to be in compliance, we don't know the window of compliance, because by the time we shift to compliance, and there's a year left on an administration, like when we passed the PFAS rule, he said by the next administration, if that changes, we have to start from ground zero again and re-implement the policies and procedures. So we need state government to be functional so that there are safeguards in place so the federal government can do their job. So that when the Trump administration or the Biden administration or whatever administration is next comes into power, there is a way to efficiently transition into structures. And so when you say who's the problem, it is a lack of communication. That word that I used earlier, interagency collaboration, when GEMA is not on the same page with Homeland Security, and Homeland Security is not on the same page as Rockdale, and Rockdale is not on the same page as EPD, and the big federal guy in the room, you know, the EPA is standing back under resourced because we have a fire in California, we've got a train derailment, we've got flooding, and now there's no lead. All you get is excuses, more of the same, and these companies know that. And I hate to use the term, but they wait out the storm and they stand there long enough to make a profit. And unfortunately, it took an explosion like BioLab to basically tear back the veil for people to actually see what's going on, and it can be prevented. And my biggest concern is that we have to do a better job of putting preventative measures in place.
But I'd never heard of that term, bad actor legislation before, but I noticed that Free was nodding a lot at that point. I wonder, why did that resonate with you? Are those things that you've been wrestling with yourself?
Yes, so excuse me, my 4-year-old is coming up the stairs. But so the bad actor legislation was actually introduced by a Republican, Rick Townsend. And so essentially what it would have done was it would have, for the industries that's looking to come into Georgia, it would have looked at their environmental track record. And it would have given the director of the EPD the authority to deny a permit based on their environmental track record. Like, say, if it was bad, if it was, you know, and a perfect example, you know, let's say what happened in Louisiana with BioLab happened, and then BioLab was looking to come into Georgia. It would have gave the EPD director the authority to say, well, you know, this happened in Louisiana, we don't want this in our state, and deny the permit. And so with Daniel, everything that Daniel was saying is resonating with me because, you know, I do this work, I kind of work alongside Daniel in some circles. So yeah.
And a question for you or for Dr. Jaggi. Not all of us are familiar with Cancer Alley in Louisiana, but you may have heard about that. And I wonder if you all could explain what that is. What is Cancer Alley and why is that a thing?
I can mention a little bit because my husband actually just went there. He's an oncologist, and he actually went to that area for a case that he was doing. And that's just an area, you guys can fill in a little bit more, where there's a lot of natural gas and oil and gas infrastructure there. And people have such high rates of cancer that they call it Cancer Alley. And my husband went there and said, gosh, the air smells weird, the water smells weird. It's kind of like a hazy look to from the flaring. I mean, he just said it was awful to be there. So I just want to give you a little flavor for what he told me because he did go to that area. And so we have to understand when we use natural gas infrastructure like fracking, children who live in those areas have higher rates of cancer. Older adults that live near those areas have higher risk of strokes and heart attacks. Those are some of the examples. There's noise pollution, there's water pollution. So, you know, if you think about creating energy out your window with a solar panel, I have solar panels on my house. It's literally outside my children's window, and I know it's safe. It's not creating any air pollution. It's not creating any noise pollution. It's safe. So, I think that's what Cancer Alley is. I wanted to actually just step back a little bit and talk about air pollution because I have two things. One, I have a lot of family in India, so I've been to India many, many times. The air pollution in India is much, much worse than it is in the United States. And so sometimes I feel like people don't realize that we have actually made quite a bit of progress since the first Earth Day in 1970. And that a lot of that is soot pollution or particulate matter. So if you see like PM, and then they talk about the size of it in microns, so 2.5 microns or 10 microns. And when you decrease, like a lot of it's PM 2.5 that they look at, and literally sometimes when I go to India, it is so polluted that it's hazy. I mean, during COVID, people stopped driving, they stopped a lot of that, and they could see the Himalayas from Delhi. So it was just like really obvious to them. But that is what we would be like if we hadn't put in all of these particulate matter pollution regulations since the 1970s. We need to do more. So sometimes we think, oh, it's just like when this explosion happened. That's also awful. But actually, every day, what's happening is hurting all of us. It's associated with premature births in babies, small babies, asthma, cancer, strokes, heart attacks, diabetes, premature death. Like so short-term mortality, when you're in those areas, there's more mortality. And air pollution is really connected with climate change when you think about something like a wildfire. A wildfire is made worse by climate change. Then you get all this soot pollution in the air, and then you have all these respiratory symptoms and all these other bad things. So climate change and air pollution are so linked. So we should, and one good thing about air pollution is, which is why we were working on the electric school buses, is the air pollution inside the bus is decreased. There's very little only from the tires, but there's very little air pollution inside the bus. And that's actually better for the children's test scores, for the bus drivers sitting for long periods of time. And the bus drivers will tell us it's quiet. They can hear the kids seem calmer. So just a lot of benefits from that. So, we have made progress. We need to make more progress, but I think if you sometimes would think about other countries and you see what is there, it would make you really thankful that we have an EPA. We don't want it to gut it. We need it. We need it because we all share the same air.
So you mentioned the PM 2.5 standard, and recently the EPA lowered the annual standard from 12 micrograms per cubic meter down to 9.
Yes.
And we know that these particles are linked to not only lung diseases and asthma, but also strokes, neurologic diseases, heart attacks, palpitations, premature deaths in babies, dementia, a lot of different problems. And it comes from a variety of things: car tailpipes, the coal-fired power plants, even the tires that are riding on the roads and aerosolize the rubber that goes up in there. It looks like Georgia EPD has said that we're not in compliance with this new standard in the metro areas of Atlanta, Augusta, Columbus, and Georgia counties near Chattanooga, and other areas near Macon. Are you all familiar with any initiatives that are being launched in Georgia to address this problem? Because we're now out of compliance and we have to fix it.
I thought
I'm
Daniel.
sorry, I couldn't unmute fast enough. First of all, I'm sorry, my bandwidth was acting up, and I'm not able to be on camera right now. But look, we got air quality standards. We met those standards in Atlanta for the first time in 30 years under my leadership at EPA, and we also met those standards of all places in Kentucky. And many of us know the history of the coal mines and the fossil fuel industry in areas like Kentucky for decades. And so I know that there are organizations, but the problem is the organizations that were funded to do the work are no longer funded, right? I mean, this is a consequence of an election when you push executive orders that blocks funding that was already approved by Congress, right? So, I mean, the thing about it is, I don't think what the Trump administration is doing is necessarily legal, but if you take money out of an organization that has the ability to fund an initiative or to collect data, for example, and those organizations have to pay their staff, they got to pay their research, they got to keep the lights on. So we're losing a lot of organizational structure that receive, for example, clean power grants, climate pollution reduction grants in other areas. So I'm very concerned because we're now seeing, which I think we can all agree, Harvard isn't the first organization to be attacked. It's just the most prominent. Georgia Tech, I'm not going to disclose it, but I had through my nonprofit work, a financial commitment through the Department of Energy that was cut 10 days after the inauguration of the current president. So we're now seeing institutions, and when institutions can no longer do the very research they're funded to do, I think we're going to see cities and states take a backseat to leadership, and we're going to have to lean on the private sector. And we see how the private sector is going right now, so I'm not too optimistic, unfortunately.
I want to make sure, Fraser, did you have something to add to that?
Yeah, I was looking to Daniel to answer that question, but there's been like a lot of pilot programs and piecemeal voluntary efforts in Georgia, but I think just in terms of robust enforcement, like through EPD to meet the threshold, I'm not seeing anything. And Daniel, you can most likely speak to this better than I can, but I'm guessing it's because of there's I think the non-attainment and attainment designations haven't been officially issued.
That's correct.
Right. And so that'll once they're officially issued, then I do believe that EPD will start to review their state implementation plans.
And really on the rules side, I mean, even going back to the discussion that just talked about Cancer Alley, the petrochemical industry at the time was severely funded, and you have now the result. If you think about the Flint water crisis, I mean, we can point to every crisis and every situation across the country that had an adverse environmental impact, and we can trace the lack of transparency, the lack of enforcement. These are areas that have impacted these areas. And I think the challenge that I'm having with the current administration is we're almost half of a year into the term, and rules have not even been set for states to be able to follow and or prioritize guidelines. And I'm very concerned about the repercussion of that over the next couple of months and even in the short term.
So one of the reasons why we chose this topic is that it's Earth Day today, and also the entire month is supposed to be directing our attention to this. And I think it's particularly important because it seems like it's so hard to wrap our arms around the latest crisis because they're just everywhere. And I feel like this one is getting under the radar now because there are so many other things we're worried about. And I wonder from any of you all, and you probably have different perspectives on this, so please feel free to comment about what do you think that we can do? Those of us who don't know the science like you do, but we can write letters, we can stand outside, we can protest, we can make phone calls. What do you suggest that we do or coalesce around?
I'll go first. For those of you that are not, this is not my day job to work on environment, but I think the way that I started getting involved actually was just getting involved in the city of Decatur. And actually, we set a clean energy goal in the city of Decatur. That was part of the strategic planning process in Decatur. And so we actually started a group called Decatur Cares About Climate. And then I just basically started working with people in our area, and that led me to see that a local government cannot reach their clean energy goals unless the state is also, and state and federal policies are also really, really important. And so that kind of actually led me to do a lot of advocacy at the Public Service Commission. So it's just mainly kind of starting to see what you're working on in your local area and joining a group and just seeing what people are doing. It's just fun because it's social, and also you are making progress. And then I've actually been working on healthcare sustainability in my hospital. And we have a kind of a small group at my hospital that's doing this work. And I've worked on pharmaceutical waste, our anesthetics. So our anesthetics are also greenhouse gases. So we're working on using those more wisely, using testing wisely. And we are, there's actually there's a whole national meeting that's going to be here in Atlanta, May 6th to the 8th, called Clean Med, and it's all about healthcare sustainability. And I mean, you learn cool things like how some hospitals have solar panels on their roof and they give energy credits to people who are of low income and partner in that way, and all these different ways that they can produce less plastic and less solid waste and all those kinds of things. So I've really just kind of thought about what I do every day and then my local community. I don't know if anyone knows Ayanna Elizabeth Johnson. She's a wonderful climate advocate and marine biologist, and she has a Venn diagram. And the Venn diagram is what brings you joy, what work needs doing, and what are your skills. And so that's the where I have worked because I'm doing this kind of work with antibiotic stewardship. And so I've always been attracted to using resources wisely and involved in my local community. And that's how I got to what I am doing. That does not mean that everyone is going to do that. That means that you use that Venn diagram and you kind of think about what you can do, and then vote in any election. Like Ted Terry is a wonderful climate advocate. He's done some really good work in making regenerative landscaping in the libraries, for instance. I think they passed a resolution today in DeKalb County for clean energy. So I would say really voting in every local election. My daughter's 20 and she's voted, I think, 3 or 4 times in every runoff. And it makes me so happy to see that because I wasn't doing that when I was 20. I don't think I knew the importance of that, but I'm glad that she does.
And can you just elaborate this connection between being a physician and caring about climate? Although we're calling this environmental health, I think that's a kind of a recent notion, that connection. Could you elaborate a little bit more about how you got there, but also about others, your peers, and the trainees? Are we teaching future doctors about this, and how do they learn about it?
So Emory University actually has a pretty good program that was started by one of my colleagues, Dr. Phillips Bourne. And actually, we were one of the first to do a kind of a more systemic, just a more formalized climate and health education. And I actually attended some of those classes to learn about it. More and more students are actually demanding for that. There's medical students for a sustainable future now, and they actually have been really spearheading getting this into the curriculum in different areas. And so they're pushing that as well. I think, climate is so big that it is hard to digest, and you can't actually live your life without contributing to the problem. So that's very hard to sort of like get all of that and get it pushed. So that we have to learn about it. What is the problem, right? We have to know what it is. So I would say our medical students are really pushing on that. And then the residents and so those are doctors in training. They're also really, really interested. And I've done several projects that kind of work on decreasing the environmental impact of the healthcare delivery system itself. And it's been super fun and creative, and they're excited about it. So I think you're going to see that happening more. And this Clean Med conference, I attended it for the first time last year. It was wonderful. Tons of doctors from different places. One of our surgeons is he's on the board for the Center for Hard to Recycle Materials. And he is wonderful. He's also I think a lot of our surgeons see a lot of solid waste and they really don't like that, unnecessary solid waste. So people are working in that area. So there's a lot going on actually in different pockets of healthcare and different specialties.
Awesome. And Free, could you also help guide us about, from your perspective, what we can do, and also how that relates to the concepts of environmental racism, environmental justice? Where could we work on those kind of things and help out?
So I am going to piggyback off of Dr. Preeti and say look at what your community is doing locally. But also reach out to your state senators and representatives and tell them the change that you would like to see in your district. So just as somebody working and going down to the Capitol to advocate for things like an environmental justice bill for the state of Georgia, the word environmental justice, especially right now, is like the boogeyman. Wants to touch it, right? But more voices, the more we bring this up and make this an issue that needs to be solved through our state legislature, then the better outcome that we'll have in terms of moving to get these issues addressed. But in terms of environmental racism, it's like policies and practices and decisions that disproportionately expose communities of color to the impacts of environmental health degradation And environmental justice is the solution or the justice to seeking restitution for that environmental racism. I do encourage everybody to get involved because as my good friend, Dr. Trevor Gear would say out of Valdosta, pollution anywhere is pollution everywhere. Pollution, especially pollution knows no district bounds. And so that's why I'm encouraging folks to reach out to their legislator, because if it's here in South DeKalb, it's also in Marietta, it's also in Valdosta, it's also in Augusta, it's everywhere. It's everybody problem. And definitely reach out to your local NAACP for DeKalb. That is the NAACP DeKalb, and our website is www.naacpdecalb.org. You can I would appreciate it if you joined my committee, as we will be moving to implement programs like how to be more energy efficient, right? My background is in public health, so I'm always moving towards behavior change and what we can do ourselves in our own environments. But definitely join us in making a difference in our county.
And I've got a question for any of you all to respond, and it's kind of an unfair question because it's really more of a, I don't know, a psychological question, but we as humans do such a great job of responding to some disasters. If planes fly into the Twin Towers and suddenly there are thousands of people mobilizing to act, there's a hurricane, we're mobilized to act on these things. And when a catastrophe is right in front of us, we do something about it. We know about these problems. This is not new. We've been hearing about it. Why does it seem so hard to get both those of us who are just not politicians and can't make these laws, but can maybe affect change, and also our leaders to do more when clearly there is a looming catastrophe?
Look, I'm gonna be very direct with you. There's three ways to answer that question. The first is that historically, the environmental movement, whether we look at natural disasters or other areas, the racial component that everyone just doesn't like to address, it had been a separate movement. So when it came time to organize around issues like climate, you had certain groups of communities, whether they be Black or Latino or whatever, that just did not see where they fit in those conversations, right? And so over time, we had these various movements that were based upon the issue of the time. Case in point, the Flint water crisis was very, interesting in a sense to communities of color because it happened in the backdrop of Detroit and Flint, and those populations were severely impacted. What needs to happen is we need to stop making climate an election issue. We have to make this a 7 days a week, 365 days a year issue all the time, whether someone's on the ballot or not. Because I'll tell you right now, whether it's folks' utility bills or it's people just don't have access to clean water or it's broadband, whatever the issue is, people need to be continuously educated in these areas. I think one thing that can happen, and I'll get into the second too, is we need to start leveraging platforms that can talk about climate. For example, I launched a company called Renaissance after leaving the Environmental Protection Agency to do work with Billie Eilish and to do work with the WNBA and the NFL. Like, sports and entertainment as a catalyst. The World Cup will be in Atlanta next year. We're actually meeting with some of the members of the International Committee on how climate will impact outdoor sports over the next decade. So we need to start taking the conversation and being on offense instead of being on defense. We can't wait for the next major storm, the next major catastrophe, the next major anti-climate policy. We got to start getting on offense and going to our tribal communities, our HBCUs, our MSIs. We got to start getting those students that are advanced at Georgia Tech to start going into cities like Atlanta with Atlanta Public School System and training young men and women how to get into STEM early. There are a lot of parallels to this conversation that we're just not embracing. And I think if we were able to focus more on these areas, the progress we'd make would be so much further.
Mm-hmm.
Dr. Jaggi, you've been doing a lot of work speaking at public hearings at the Public Service Commission recently because of some issues regarding power plants. Can you explain what's been going on there?
Yeah, I've spoken at the Public Service Commission probably 4 or 5, 6 times, as have you. So I don't know if I should give a little quick 1 minute about what they do. Okay, so and others may be able to chime in if I'm not explaining it correctly. But basically, in a nutshell, we have a regulated monopoly in Georgia, which is mostly Georgia Power, which produces most of the power in our state. And in return for them being a monopoly, which is kind of a long-standing issue, why they have that, they have regulation. And in our state, there are 5 people that are the public service commissioners, which really should be called the public utility commissioners, because that's what they're regulating, Georgia Power. And so their charge, as I read on their website, is the safe, affordable, and reliable electricity for the consumer. And then they're supposed to have some component of like helping Georgia Power stay solvent, basically, because they have to be able to provide the power. But so for me as a consumer, safety, affordability, and reliability. I think the bills are super high. So that a lot of the past decisions with nuclear have been very, very expensive, and so we're reaping the consequences of the cost, which is also bad for your health, because if you can't afford you're spending all your money on utilities, you can't afford food. But also for me, what I have been talking about then is the safety. The safety, the safety, the safety, the safety. It is not safe to burn fossil fuels for human health. And so we've talked about that. That has really been our message, is this is not safe. So that's both for local air pollution. The closer you are to where they're burning fossil fuels, the worse it is for you. And the worse it is, like, it's loud, it's smoky. I just spoke to a woman who was at Plant Shear. It's loud, it's smoky, and we know all of those health effects of air pollution that we talked about. You are more likely to get those in those areas. And they have to clean up coal ash, which is toxic, so that's expensive. So right now they do this planning process every few years to plan for the next 15 to 20 years of electricity, and they are planning on delaying the retirement of coal, which is much worse for climate change, and it's really bad for air pollution, and putting in new gas infrastructure. When they say natural gas, you should hear fossil gas. There's nothing that it's fossil gas. It is not good for you. There's a whole article in the New England Journal of Medicine about why this is not good for our health. So that's what we have been talking about, is that this is not safe. And it's expensive. So, I mean, I just don't understand why one would want to be doing that. And we have really spoken many, many times. I've sent them articles. I've spoken to them many, many times about that. The last time I went, I said, I don't want my electricity coming at the expense of a child getting leukemia. I see those children that get leukemia in the hospital. I don't want that. We don't want that. We're all in this together, one health. That's what we've been talking about. So there are 2 elections this year, out of 5, 2 are up for election. So this is a really, really important election to pay attention to. Please vote. The primaries in June, and in November is the election. The other thing that we can put in the chat right now is we made it kind of easy with Mothers and Others for Clean Air to make a public comment that you want clean, safe energy. And you can do that today. I'll be going to the hearing on the 27th of May, and we'll count how many people have made comment. I know for sure we're up to like 150 people.
And do we know what the timeline is for that decision? Where are we at?
Ooh, I think it's in June that they make a final decision, but May 27th is the next hearing.
Okay. So we do have some questions that I want to get to. Some people have thought of things that I did not. One question is, and this is not going to make you feel better, the answer, I don't think. How many other plants in the Atlanta metro area have the potential to be another major incident like the biolab accident in Conyers? I don't know if you all know that, but are there any high-risk areas that could be the next biolab?
Well, I mean, look, historically, some folks may remember Sterigenics, which not necessarily was about, the biolab explosion. What I can tell you without going too far into detail, because some of them were given to me while I was a regional administrator, and there were certain, clearances that I had that I'm not at liberty to share, but there were at least 20 within the metro Atlanta region that were on our radar. And when I say 20, that does not mean that we can have 20 biolab instances tomorrow. It's just we have traditionally seen And we categorize them under what's called SEMD, which is Superfunded Emergency Management. And we've regularly seen everything from landfill fires in South Fulton, which we help to pull out, to issues that are affecting areas with chemical safety facilities that have been in violation for a tremendously long time. And because I'm not more than 2 years removed from my position, I'm not at liberty to discuss them. But they are well, I was going to say they're open, but the Trump administration has scrubbed so much information and data from offline that we really don't have that roadmap that we had. We literally had kind of a Dirty Dozens Bad Actors roadmap that was established during Administrator Reagan's tenure, and we were able to look at states and cities specifically where we saw it. And I can tell you that at minimum 20 or 22 of those were within proximity to the Atlanta metro region.
All right. Next question is about educating ourselves a little bit better. Where can volunteers access handouts and other documents to help broaden public understanding about how these things impact our health? Where can people learn more? Trusted sources? Where would you all suggest sending them to?
The New England Journal of Medicine has some nice videos. I put one in the chat. We've done a couple of videos for Decatur Cares About Climate that I also put in the chat.
Great. And now it just occurs to me, I do want to get to one more thing, Preeti, before you go, and that is, as I listen to you talk about the many concerns in our environmental health concerns, things that are in the air that you can't see, water that you can't taste, but it's there, it can make us all rather paranoid. And it can definitely add to the concern that there's dangers everywhere, even when there are not. So how do you balance the concern, the legitimate concerns about the environmental threats that we have from things that we've done to ourselves with things that are actually good for us, like vaccinations, and other health interventions that people now are in a similar vein kind of worried about? How can you help people balance that so they don't get unraveled?
Yeah, I mean, I think when you talk with your physician, they want your best interest. So, for me, vaccination is so hugely important because I've seen vaccine preventable illnesses. I remember when I was a fellow, I saw a child that had no vaccination, got chickenpox, and then had a bacterial superinfection of her chickenpox, and she was in the intensive care unit for 3 weeks, and she had so many like debridements of her leg. It was horrible. So, you think about that, and that's just terrible. So, vaccines are really helpful because you just think about all the things that you get exposed to just being, all this instrumentation and all the things you get exposed to just being in the hospital. So, most of the time, your physician is not going to lead you astray because they're like the things that are good for the environment are oftentimes good for your health. Walking more, for instance, eating fruits and vegetables, things like that. So I think the things that your physician is going to gear you towards is really usually right, spot on, good for you. And I would say, especially when we're talking about climate, because sometimes you can also make yourself crazy. I mean, for me, I do think about this because I'm also taking this plastics and health class, and boy, plastics now, that's like a big thing. We didn't even talk about that today. So some health effects with plastics. So what I try to do is just focus on making system changes, right? Like really, if you're so obsessed with your carbon footprint, you're going to actually not be able to make as much actual impact. System change is what we need. So voting, joining a group, try to work on and focus on a system. That's what my advice is because you can just drive yourself nuts. You'll just have to sit there and do nothing all day because you can't think about anything, all the things that are potentially out there, but work with a group and work on a system level changes. Like I know in DeKalb County, there's some hiccups now, but they're working on some composting initiatives. Composting is a really great way that you can do every day to keep carbon in the ground. So that could be something you do. Planting trees decreases air pollution. So that's all good. And it helps with water runoff. Those are some good things to do too. So just find a group. There's Trees Atlanta. There're just so many groups that for me, that is really great because I feel like I meet such wonderful people and that feeds my soul while I do the work.
Baby steps. I will tell you, every time I go to Charm Atlanta for the recycling, it's just a good feeling just going there and seeing those people. They are wonderful in what they do. Um, Free, any final thoughts from you about things that people should take away from this webinar tonight?
Yeah, so it is always good to let people know that there are things that can be done. I don't particularly go for the doom and gloom. I too myself get caught up in the, oh my goodness, I'm contributing to this, but I'm also doing something, right? I'm doing grassroots work to address some of the issues that we have here in Georgia. So it's when delivering information, we want to be really careful that while we talk about the problem, we talk about what solutions there are too, or how we work towards solutions. And so again, just honing in on what's happening locally around you, I'm quite sure there is some local organization doing this type of work, and nobody's averse to having an extra set of hands, right? So just ask your local organization, how can I get involved? What do you all need help with? And contribute that way.
Fantastic. And Mr. Blackman, final thoughts from you, sir.
Yeah, my final thoughts are really just to hone in on where, look, we've got to be a lot better at forming coalitions and actually being available to each other, especially in the times that we're in. I think we need to all reevaluate not necessarily our circles, but our communications. I mean, I really like the question that you asked a few minutes ago about books and resources, because one thing that I think we don't do a good enough job of is sharing resources where information can be gathered, where people can organize. We've got to start, rethinking it. I mean, right now, everyone is, in a state of fear and, resorting to Signal and other, locations. And I think the reality is we got to get back to community building. We got to get back to being able to turn people's living rooms into organizing. I mean, the Montgomery bus boycott lasted 381 days, shut down the entire system, and changed about 10 civil rights laws. But it was started with 11 people. And if we can take our 11, if we can take the almost 30 people in this room and just start there, we can change a lot of things that communities and individuals have struggled with. So thank you for the opportunity.
Thank you. Thank you, Free Asia, for sharing your expertise. Dr. Jaggi, thank you so much. I also want to thank the people that are behind the scenes that you don't see. Amy Farrow, Dr. Bola Tillman, they're the ones that are making the magic happen on Zoom and making sure that I don't mess up tonight. I want to remind you all about the future webinars that we're having. We're going to be doing this again on May 7th, and it's focused just on the Public Service Commission. What do you need to know more about it? Why should you care? Why should you get out there and vote when it's time to vote? We will be having a candidate forum on the 21st, and then our June webinar is going to be on gun violence in Georgia. So we've had some amazing speakers tonight. We plan on having amazing speakers again. I hope you all spread the word, and thank you for joining us. Y'all have a great night.
That's